Before you take that first Lexapro pill or decide not to, let's talk about how Lexapro works in your brain, key side effects, why it may stop working, and an integrative approach that boosts results beyond medication alone. I'm Dr. Ayer, quadruple board certified psychiatrist and anxiety specialist. Lexapro is an SSRI, a selective serotonin reuptake inhibitor. What that simply means is this: your brain has a chemical called serotonin that helps regulate mood, calm emotional reactivity, and lower the intensity of your threat response. When anxiety takes hold, your brain's alarm system, the amygdala, becomes hyperactive. It fires too easily, too often, and too loudly. Lexapro helps turn down the volume on that alarm. It usually doesn't sedate or numb you. When it works, it brings calm, allowing your nervous system to settle. That calm is key. It lets you start to heal. I've had patients tell me that Lexapro gave them their life back. They could sleep, they could think clearly, they could be present with their family without a storm running in the background. For some, medication is the right first step. It provides breathing room, which is valuable. Let me reassure you, taking Lexapro is not weakness or giving up. Sometimes it is the best clinical step, but most discussions stop here. Let's continue to what's often left out. Lexapro adjusts serotonin levels, but it doesn't fix the underlying reasons your nervous system became dysregulated in the first place. It doesn't resolve chronic inflammation. It doesn't balance your cortisol. It doesn't stabilize your blood sugar. It doesn't repair your sleep architecture. It doesn't address hormonal shifts that may be driving your anxiety harder than any brain chemistry imbalance. Alongside these limitations, it's important to discuss potential side effects. Sexual dysfunction is one of the most common and one of the least discussed. Reduced libido, delayed orgasm, problems with erection, emotional distance, and intimacy. Studies suggest this affects anywhere from 30 to 50% of people on SSRIs. That's not a small number, and yet many patients are never warned. Emotional blunting is another. Some feel wrapped in cotton wool. Anxiety lessens, but so does joy or motivation. Life feels flatter or less alive. Startup anxiety is common. In the first few weeks, many feel worse before they improve. Without warning, this can be scary, causing people to stop too soon. Discontinuation syndrome can occur if you stop Lexapro abruptly. Brain zaps, dizziness, strong emotions, and anxiety. This is real, which is why I always closely supervise medication changes. Now that you know the medication's effects, here's the question I want you to dwell on. If Lexapro only adjusts serotonin, what about everything else that's driving your anxiety? Because anxiety is not just a serotonin problem. Think of it this way. Imagine your nervous system is a house and your smoke alarms keep going off. Lexapro turns down the volume on the alarm, but if there's still smoke in the house, the alarm is going to keep going off the moment you lower the volume. The smoke is what most people are never taught to look for. 1. Cortisol dysregulation. When your stress response system runs hot for too long, your brain starts treating normal life like a constant emergency. Your cortisol rhythm gets inverted. You feel wired at night and exhausted in the morning. No SSRI fixes that. 2. Chronic inflammation. Inflammation is bad for the body and the brain. Poor diet, gut imbalances, insulin resistance, lack of sleep. All of these fuel inflammation, and inflammation fuels anxiety. 3. Blood sugar instability. This one surprises people. When your blood sugar crashes, your body releases adrenaline to stabilize it. That adrenaline surge could, for some people, cause symptoms similar to anxiety and panic attacks. Racing heart, lightheadedness, sudden dread. Lexapro will not touch this. 4. Mitochondrial dysfunction. Your mitochondria are the energy factors inside every cell in your body. When they're not working well from chronic stress, poor sleep, or poor nutrition, your brain doesn't have the energy it needs to regulate emotions and calm the threat response. A fatigued brain is an anxious brain, and no SSRI restores cellular energy production. 5. Sleep disruption. Sleep is when your nervous system repairs itself. When you're not getting deep restorative sleep, your amygdala becomes more reactive. Your emotional regulation weakens, your anxiety threshold drops. And for many adults, especially those in their 40s and 50s, hormonal shifts are quietly amplifying everything. For women, the estrogen decline of perimenopause directly affects serotonin and GABA, the brain's two main calming systems. For men, low testosterone is linked to increased anxiety, irritability, and poor stress recovery. These are biological realities, and no antidepressant addresses them directly. This is not a criticism of the medication. It is a recognition of its limits. Lexapro can be one layer of your recovery, but if it's the only layer, you're leaving most of the work undone. And one of the most powerful and underrated things you can do for your nervous system, something Lexapro absolutely cannot do for you, is repair your sleep. I have a free sleep guide in the description. It covers exactly what I recommend to my own patients. The link is in the description below. So then, what does a complete treatment plan actually look like in practice? The goal is not necessarily to avoid medication, although it is possible in some cases. The goal is to not need more of it than necessary, and to give your brain and body every possible advantage at the same time. Here's what I consider a complete plan and how it all fits together. Good quality sleep. Before anything else, poor sleep makes every anxiety treatment less effective. If your sleep is broken, fixing it is the highest leverage move you can make. Stabilize your blood sugar. Eat protein with every meal. Reduce refined carbohydrates. Avoid long gaps between meals. This single shift eliminates a significant source of adrenaline spikes that many people mistake for anxiety. Address inflammation. An anti-inflammatory diet, more whole foods, less processed foods, less alcohol, directly reduces the brain inflammation that keeps the nervous system on high alert. Move your body. Exercise is one of the most powerful anxiolytics we know of. It lowers cortisol, raises BDNF, a brain growth factor, and recalibrates the nervous system in ways no pills can replicate. Even 20 minutes of walking daily changes your brain chemistry. Consider targeted supplementation. Magnesium glycinate, omega-3 fatty acids, and ashwagandha have strong evidence for anxiety. These are not replacements for treatment, but they support the biology that medication doesn't reach. Selexan, a lavender extract, has been shown to be helpful for anxiety treatments. Consider therapy, specifically cognitive behavioral therapy, CBT. This is one of the most well-researched treatments for anxiety we have. It works by helping you identify and rewire the thought patterns that keep your nervous system stuck in threat mode. Medication can quiet the alarm. CBT teaches your brain not to pull the alarm in the first place. When combined with the biological strategies above, it is a powerful part of a complete recovery plan. And if you're in midlife, get your hormones evaluated. Testosterone, estrogen, progesterone, thyroid. These numbers tell a story, and that story often explains why anxiety has been so resistant to treatment. When you layer the strategies alongside medication, or instead of medication for some people, something shifts. The nervous system stops being managed and starts actually healing. The question was never whether Lexapro is good or bad. The real question is, what is driving your anxiety that no pill has ever been able to reach? And that's what this next video talks about, because that's where your real recovery begins.